Hello, and welcome to Session 1 of the LADS WA webinar series, looking at aspects of and strategies for parenting a child with ADHD. In this first session, we look at what is ADHD. But just before we begin, I'd like to sincerely thank the West Australian Police Department, whose valued support has made this webinar series possible, as well as the 6-week in-house parenting program run through LADS WA possible. I suggest that if you enjoy this webinar series, you may consider enrolling in the 6-week parenting program that will be run again in 2018 through LADS WA. It's a great opportunity to meet with other parents who have children with ADHD and listen to their experiences and their stories. So just a little bit about myself. My name's Elena Trethowan. I'm currently a provisional psychologist. I have a background in medical science, primarily in genetics and pathology. I have 3 children of my own. All my children have Tourette's syndrome, and my middle son also has ADHD. So this is a personal as well as professional interest of mine. I've done a little bit of research in the past looking at the experiences of parents who have children with ADHD around stigma. And myself, I have 10 years experience in counselling, working with young people, families where there's alcohol and drug use, and also the last 5 years I've been doing family support work. I also have a personal and professional interest in the practice of mindfulness. So the purpose of this course. When my son was younger, I was looking my son with ADHD, I was looking for some parenting courses that really might give me the kind of the strategies and the information that I needed, because I found that parenting my son with ADHD was different from my other 2 children, and I couldn't really find what I was looking for. So that was kind of the beginning of the ideas that underlie this course. So this course is to provide a parenting information and strategies that are tailored for the unique needs and experiences of parents bringing up a child with ADHD. Now, some of the information in this course will be generic parenting information, but all of the information that we have selected and put into the course is designed to be useful specifically for parents with children with ADHD, and any general parenting principles will be viewed and presented through an ADHD lens. So first, to ask the question, why learn about ADHD? And I think for me, the answer to that is that not all children with ADHD present similarly. They have different characteristics and they may have different symptoms of ADHD, and the profile of ADHD may look differently from child to child. So I think the more information we are armed with as parents, the more we're able to flexibly kind of adapt our parenting strategies and approach to our particular the needs of our particular child, and the better we are able to advocate for our child in the school and healthcare setting. So the structure of the course. In session 1, the first webinar, we're looking at the neurobiology and neuropsychology of ADHD. So what is ADHD? How does it relate to the way the brain works? And how does that relate to the child's behaviour? Session 2, we look at general parenting principles that are useful when you're parenting a child with ADHD, and we'll also look at specific aspects of parenting that are specific to parenting a child with ADHD. In webinar 3, we'll be looking at managing ADHD, using modifications and accommodations around the home and what that might look like. Sessions 4 and 5 are really looking at specific strategies, maybe a bit of self-reflection on ourselves as parents and what our triggers are, and also looking at the really important task of relationship building between parent and child and how that can impact on the child's behaviour. And then lastly, for the last webinar, we'll be looking a little bit about mindful parenting and also self-care for parents, because we know how important that is. So just a little bit about LADS WA, the Learning and Attentional Disorders Society of WA. LADS is a support, information and advocacy agency founded in 1993 for and by people with ADHD and associated conditions. So LADS runs a helpline service where you can ring up and ask about different aspects of ADHD, find practitioners who we know specialise in ADHD. We also have a library, and LADS has a parent coach and psychologists on site in their offices, and we also run information sessions at different points throughout the year. And the website is located just at the bottom of this slide. So I encourage you to have a look and have a look at some of the services that LADS WA offers. So in this first session, we'll be looking at what is ADHD. We're looking at how we define ADHD and what the characteristic symptoms and presentations of ADHD are. Then we'll be looking at what are executive functions and how do deficits in executive functions relate to some of the symptoms we see in ADHD. Then we'll be looking a little bit about what the cause underlying ADHD may be. Although we don't know specifically, we'll be looking a little bit around some of the neurobiology and neurogenetics of ADHD. And then lastly, we'll be looking at what are some of the other conditions that commonly occur with ADHD. So ADHD is the most common neurodevelopmental disorder of childhood. It's also the most widely researched psychiatric disorder of childhood. And ADHD has a prevalence of around about 5 to 7% in school-aged children. Now this prevalence can be slightly higher. Sometimes I think in the US it's around about 12%, but generally rates are 5 to 7%, and this is around the world. So this gives some indication of the inherited genetic neurobiological basis of ADHD. That's not to say that factors like the environment, the parenting factors or school factors or other social and cultural factors will not influence how strongly the symptoms are expressed, but it just means that they're not the original cause of the ADHD symptoms. ADHD used to be thought of as a disorder of childhood, but now we know that roughly 2/3 of children with ADHD will also experience symptoms of ADHD from adolescence into adulthood, although the symptoms of ADHD may look slightly differently in adulthood. For instance, the motor restlessness and the physical hyperactivity in childhood may look more like a inner restlessness, internal restlessness in adult ADHD. So the Diagnostic and Statistical Manual of Mental Disorders, otherwise known as the DSM, is kind of the Bible of psychiatry and psychology in Australia and America and other countries around the world. And in the DSM, the different disorders are categorized under different categories, and each disorder has a list of diagnostic criteria that must be met for that in order to diagnosis to be made. And ADHD used to be classified in previous DSMs under the behavioural disorders category, but in the latest DSM, which was published in 2013, that's DSM-5, ADHD is now classified under the heading of neurodevelopmental disorders. So that's quite a big shift from an idea that ADHD was a disorder of behaviour now to the understanding that it actually has a neurobiological basis. It's also said that ADHD is a heterogeneous disorder, which means that symptoms of ADHD may look differently from one child to the other. So as you can see to the right of the slide, there are 3 kind of core symptom domains in ADHD, and those symptom domains are inattention, hyperactivity, and impulsivity. And quite often the impulsive and hyperactive symptoms are grouped together, and the inattention symptoms are kind of grouped separately. So you might say that one child is primarily inattentive, so this child's more likely to have perhaps be a bit dreamy, a bit forgetful. They might have trouble focusing on tasks and carrying them through to completion, whereas the child with primarily hyperactive impulsive symptoms may be more physically restless. They might be tapping and moving around, always having to talk, always having to not being able to sit still. So those are the kind of symptoms, but also commonly children will have both or all hyperactive, impulsive and inattentive symptoms, and that would be known as combined type ADHD. As I mentioned before, ADHD has a neurobiological basis, but the symptoms of ADHD arise from the dynamic interplay of genetic, biological, relationship, social and environmental factors. And the environmental factors and the social factors can absolutely increase the intensity of the ADHD symptoms. If there was one single treatment that was evaluated as the best treatment, the most effective treatment for ADHD, at the moment it's still pharmacological treatment. Usually some sort of amphetamine-based treatment such as Ritalin or dexamphetamine. However, the most effective treatment for ADHD is shown to be multimodal treatment. So that is medication in combination with other treatments such as behavioural treatments, parent training, other behavioural treatments, occupational therapy, and other supportive treatments, perhaps learning support if the child also has learning disorders. But it's an overall picture for supporting the learning, home, biological and social domains. So that's multimodal treatment, and that's shown to be the most effective treatment, that combined treatment for ADHD. So as we mentioned before, the symptoms of ADHD are related to abnormalities in neurological functioning or development. And we'll get into that in a bit more detail in the coming slides. But just in relation to the DSM diagnosis of ADHD, for a diagnosis to be made, the symptoms of ADHD in the child should be present early on in development, preferably before 12 years of age. They should be there, the symptoms should be evident across all settings, so that's at school, at home, and in various other social situations. They should be persistent over time in development, so they don't come on for 6 months and then go away and come back a year later. They pretty much should be present most of the time and evident over time. The impact of the symptoms should in some way quite substantially affect the child's ability to function successfully at school, at home, and to meet the typical demands and major life activities of a child their age. In addition, the symptoms of ADHD to meet diagnosis should not readily be accounted for by something else that's happened in the child's home or school environment, by social causes, or by other additional diagnoses, such as anxiety, for instance. So, as we mentioned before, ADHD is a neurodevelopmental disorder. And what does this mean? It means that the brain of the child with ADHD is developing, in some areas of the brain at least, at a slower rate compared to other children of the same age. And this means that children with ADHD exhibit age-inappropriate behaviours. Often the behaviours that children with ADHD exhibit aren't unusual for most children. Most children have difficulty sitting still, will interrupt on a conversation, will react inappropriately sometimes, depending on their age. But what is different in ADHD is that these children are expressing these behaviours at an age where they would be expected not to express them. And this moves on to what Dr. Russell Barkley is one of the lead researchers in the world on ADHD. He describes the child with ADHD being different from their peers in a quantitative way, not a qualitative way. And what he means by that is that children with ADHD don't exhibit unusual symptoms that aren't seen in other children. They exhibit symptoms that are seen in other children. They're just more pronounced, they're more disruptive in the child's life, and they're expressed, as I've mentioned before, at an age where the child would be expected not to express them. At an age where a child might be expected to sit still and focus and concentrate on their work, the child with the ADHD finds it really difficult to do so. And why is this the case? As you can see in the pictures up to the right of the slide, in ADHD, the thickness of the cortex, which is the outer layer of the brain, is developing at a slower rate compared to children without ADHD. So children with ADHD, especially in the prefrontal areas of the brain, which are those involved in executive functions, the cortical thickness, the outer layer of the brain, is quite substantially smaller than children of the same age. Russell Barkley puts it that children with ADHD, this causes a developmental delay. So children with ADHD, their executive functioning skills, and we'll get onto this in a minute, may be somewhere in the vicinity of approximately 30% a lower age, a 30% lower age than would be expected. So for instance, if your child is 10, their executive functioning capacities may be those of around about a 7-year-old, depending on their age. And the behaviour in certain areas is either excessive, so as I mentioned before, the symptoms of ADHD, some behaviours are excessive, for instance, the motor movement, motor activity, and some areas, some behaviours may be reduced in ADHD. For instance, the ability to control impulses is reduced in ADHD. So this lag in brain development in children with ADHD, what might this look like in the day-to-day life of the child? What skills and abilities might be affected by ADHD? As most parents of children with ADHD have already observed, these are some of the main areas of life which the symptoms of ADHD impact upon. So organisation, planning and learning, and this relates to those parts of the brain that are developing more slowly, that are implicated in executive functioning. And we'll be looking a little bit deeper into what executive functioning is and how it relates to behaviour in the coming slides. The other area is self-control, and so this speaks to the hyperactive and impulsive symptoms of ADHD. Children with ADHD have a hard time inhibiting their motor responses. They can't sit still, as well as their verbal responses. They tend to act first and think later. They're not thinking of the consequences or holding them in mind when they're acting. The other domain, which can cause a lot of heartache for both parents and child alike, is that children with ADHD often can have trouble with their social skills. And this can be to do with the hyperactive and impulsive symptoms impacting on upon their social relationships. So kids with ADHD often have that harder time making and also keeping friends, especially when they're in the primary school age range. So we've talked already a little bit about executive functions, and the executive functions are related to the prefrontal cortex area of the brain. But what are executive functions? Executive functions are a unified term for the cognitive processes and capacities that regulate, control, and allow us to sustain action and problem solving towards a goal. And even in that one sentence, we can start to get an idea of how the deficits in executive function can impact upon ADHD and result in the symptoms of ADHD. So the three main domains of cognitive skill implicated in ADHD are working memory. So that is the ability to hold the knowledge of what you were doing and what you were supposed to achieve in mind while you're doing a task. So with children with ADHD, often they forget what they're doing in the middle of what they're doing. I'm sure a lot of parents are familiar with that. The other executive function is the capacity for cognitive flexibility. So that's parents may see that in their child, with a child who's having difficulty in making transitions. So they're involved in a task and the parent says, no, it's time to put the computer away, it's time for dinner, or it's time to stop reading the book and come out and do whatever it is. But the children with ADHD often have quite a lot of difficulty transitioning from one task to another. And also they have quite a lot of difficulty with getting when things change from the normal routine. So they have a difficulty in being flexible and adapting to those changes. And the other one, which we have already mentioned, is inhibitory control. So that's the ability to inhibit the focus of attention from moving from one task to another and getting distracted. It's the ability to inhibit the emotions as they come up if it's not socially acceptable to express them, and also the ability to inhibit motor control and to be able to sit still and to control what we're doing, and when it's appropriate to do so. So those are the kind of main domains of executive functioning that are implicated in ADHD. So Dr. Russell Barkley, who some of you may already know, you may have read some of his books or been to his website, proposes that ADHD might be more accurately described as executive functioning deficit disorder rather than attention deficit disorder, because he believes that it is deficits in the core capacities of executive function that really underpin the symptoms of ADHD. And we can see some of these capacities outlined below in the slide. So activation, that's actually getting started on a task, not procrastinating, getting motivated and planning and actually starting work on something. Focusing in is being able to tune in and being able to regulate what we're paying attention to. Effort is the amount of regulating the amount of effort we put in, working harder if we needed to, focusing on something and keeping our focus on something when the situation requires us to. Emotions, again, like I mentioned before, is about the ability to express emotions when it's necessary and when it's appropriate to do so, but also being able to inhibit emotions when those emotions might be inappropriate to the given circumstances. So memory, as we talked before, the memory talked about in executive functioning is working memory. So that's the ability to hold information in mind and use that information as you're working on a task towards a specific goal. And the other one is action. So this is the self-talk, being able to tell yourself, oh, I was supposed to be doing this and I should be doing this, and that kind of self-talk that keeps us focused and keeps us going and regulates or changes our actions in relation to a specific task. And here we again see a different diagram of those same executive function capacities. And here to the right you see a picture of the brain, and you can see the frontal lobe, the area of the brain that's really associated with our executive functioning capacities. And it's that frontal lobe that's shown to be that much, it's the outer layer of that frontal lobe that's shown to be quite substantially reduced in children with ADHD compared to children of the same age. So if you'd like to learn a little bit more about executive functions and have what the information that I've given you put in a bit of a visual context, I invite you to go to YouTube and have a look at, it's only, I think it's about 6 or 7 minutes, a brief clip. It's, if you just type in the title that's here, in brief, executive function, skills for life and learning, it should come up in the browser straight away. So I invite you to have a look at that clip and just have that information be put in context. Well, I hope you got to have a look at the video and enjoyed it. I think it's a really good way of illustrating what executive functions are and how they look in children. So again, just moving back to the DSM criteria, I'm just going to focus on basically the two areas of ADHD, inattention and then hyperactivity, impulsivity. I'll present together. So inattention, what does it look like in the child with ADHD? As many of you may have already observed, it may look like difficulty in persisting towards a goal, difficulty with a sustained attention and in keeping focused on a task at hand. Children with ADHD also, they seek stimulation. So in relation to inattention, they might be doing a specific task, but then something comes along and it's more fun, it's more colourful, it's brighter, it's louder, and they get distracted from what they were doing and their attention turns to something that's more fun and more reinforcing for them. Also, children with ADHD in the realm of inattention, they find it harder to return to a present task when they've been interrupted. So once they've been interrupted from the task at hand, they find it harder to remember what they were doing before. So they get distracted and then their attention moves on to something else and they completely forget what it was they were doing. And as I mentioned before, children with ADHD are very attracted to things that are bright and shiny and fun and interesting and engaging. They have a lot greater difficulty maintaining their focus and attention on tasks which they find uninteresting or boring or difficult. So the other domain of symptoms in ADHD is the impulsive hyperactive symptoms. So quite simply, children with ADHD find it harder to inhibit those behaviours that other people would usually inhibit for social reasons. So the children with ADHD, they want something, they want it now, they're not going to wait, they may appear to be demanding and impatient, putting pressure on their parents to have something now. They also may find it really hard to inhibit their behaviour if they've got a strong emotional reaction to something. Often they'll express it there, and quite often in a way that's not socially acceptable in that situation. So they can end up getting into trouble. And I will mention here that children with ADHD, they do know that they're not supposed to show that behaviour. They just find it very hard to inhibit that behaviour. So as we mentioned before, they find it hard to show restraint. Children with ADHD, characteristically, if they have hyperactive impulsive symptoms, they'll act first. They'll do the first thing that comes into their mind. It's a great idea. They do it. They're not thinking the consequences of their actions when they're doing that. Also, children with ADHD may be talking very loudly. They may talk non-stop. And if they're not talking, they may be making noises or sounds or kind of babble or singing. Just often lots of excessive talking or verbal utterances, and also, as we often know, excessive movement. So they're climbing, they're wriggling, they're tapping, they can't sit still in their seat, they're not good at waiting in line, they want to push in front of other kids. This also expresses itself often in taking shortcuts or risks when they're not, again, this is part of not thinking about the consequences of their actions. They just want something and they want it now. Children with ADHD, as you can imagine, with this kind of symptoms, tend to be more accident prone. They're not thinking through the consequences of what they do. In adolescence and adulthood, this may translate into issues with managing money or managing credit, again, with being able to inhibit the kind of behaviours that they know might cause problems in the long run, but they want the immediate reward then and there. Again, with the impulsivity and hyperactivity symptoms, this may translate into the cognition. So children with ADHD, they often have problems inhibiting task-irrelevant thoughts. So that's kind of where this is part of the picture of distraction in children with ADHD. So just to summarise some of the things we've been saying about difficulties with executive functions that is often seen in children with ADHD. What does this look like in day-to-day life? We will in a minute, in a few slides' time, talk about how it looks like in the pre-primary child, in the primary school child, the middle school child, and the high school child. But for now, just a general kind of summary. Children with ADHD often have difficulty remembering instructions and directions that are given to them. So that's that issue with working memory, about keeping instructions and information in mind when working on a task or working towards a specific goal. And again, in relation to the impulsivity, children with ADHD have problems thinking things through. They often don't think through the consequences before they take action on something. Paying attention to new information, again, that may be to do with issues to do with attention, noticing what's going on in their environment, or it could be to do with mental flexibility, being able to apply what they're seeing in the environment into what they're doing. So that's applying knowledge from one area to another, or being able to be mentally flexible and adapt something that they know in one situation to another different situation. As we mentioned before, children with ADHD often have a lot of difficulty staying focused without getting bored or without getting physically restless. So they're jittering, they're moving around, they're tapping, their eyes are wandering, they're looking for the new kind of stimulation, for something different, for something to catch their interest. So being aware of one's own thought processes, and Russell Barkley talks about the child's inner voice, that voice that directs us when we're going through a goal-directed activity. Okay, we need to do this. No, let's not do it like that. Let's do this. Okay, don't forget, I've got to remember to do this. So that's that kind of inner voice that guides us through the tasks and reminds us what we need to be doing to stay on task. And again, as most parents with children with hyperactive, impulsive ADHD have noticed, children with ADHD often have big troubles with regulating their emotion, and that includes expressing it in situations. They have trouble inhibiting the expression of their emotions in situations where it might not be so socially acceptable to express that emotion. So Russell Barkley, who you'll hear from in a minute if you choose to watch the next YouTube clip, describes ADHD, we mentioned before, as a deficit of executive function, but he also describes it as a performance disorder. And this is in as much as ADHD is not a problem of knowing what to do. Most children with ADHD, they know what they should be doing, or they know what they want to do. They have a problem of doing what they know. They have a problem of actually finishing tasks. They have a problem of staying on tasks. They get interrupted. They forget what they're doing. It's not that they don't know what to do. They just have a problem of doing it. And this is related back to the deficits in executive functions. And because of this, interventions for children with ADHD, they have to be external. They have to be reminders, motivations, incentives, but they have to be external to the child, and they have to be there at the point of performance. And that means that if a child needs to be reminded to put their school uniform on or to pack their bag, there needs to be a note next to or on the bag reminding them to do something. So it's just having those constant external scaffolding or reminders around the child to allow them to be able to show what they know. And as it said below on the slide, for children with ADHD, we need to re-engineer the environment so that the child can show what they know. So this is just a kind of a little a model talking about the zone of proximal development and scaffolding. And all that really means is that parents of children with ADHD quite often have to put in a lot of more structure, a lot more routine. They might have to put in a lot more, as I mentioned before, reminders, star charts, rules, regulations, consequences for actions, all sorts of different environmental scaffolding around the child to keep them on task, to keep them motivated, to keep their behaviour within the relatively socially acceptable range. So this is just children with ADHD, they often need their parents' involvement to a higher degree and for a longer time than children without ADHD. And if you'd like to hear from the man himself, Dr. Russell Barkley, I invite you to go to YouTube and type in the title below and listen to what Dr. Barkley has to say, a few words on ADHD and executive functions. So as I said I would do before, I'll just give you a quick snapshot of what executive function issues may look like for children of different ages in their day-to-day life. And this information is taken from the Understood website, which is an American website that caters for individuals and gives information about attention and learning disorders. So that might be a website you might want to check out. So firstly, for the pre-primary age child, what do executive function issues look like? So they may get easily frustrated and often throw things on the floor instead of asking for help. They may have trouble following directions and often forget what to do. They may have frequent tantrums over things that seem fairly minor and manageable for most children their age. They may act out aggressively instead of expressing feelings and frustrations through words. They also may be very reactive emotionally. They may find it difficult to master simple classroom tasks like finding things in the cubby or packing up or packing away at the end of the day. They may frequently raise their hand to answer a question, but when they're asked to answer the question, they can't remember what they were going to ask. They may often insist on doing things a certain way and have trouble making adjustments to their routines. They also may frequently give unrelated answers to questions during group time. irrelevant information. So that's just a brief snapshot of what executive function issues may look like in the pre-primary age child. So what might executive function issues look like in the primary school age child? The child may start one task and get distracted and then not finish the original task. They might be able to solve a maths problem, for instance, one way, but then they get stuck when asked to solve it using another method. The child may focus on the least important thing that you said. They may focus on the least important part of a conversation but get fixated on that particular point. The child may mix up assignments, not bring home the books, not bring home handouts or notes that the parents needs to sign or that they need to complete their homework. They might have a desk full of loose papers and pencil stubs, but their schoolwork, their homework folder and pencil box are always empty. The child may panic when rules and routines, the regular routines and habits of a family are challenged. For instance, you tell them you're going out to dinner instead of ordering in, but they're freaking out because it's Friday and Friday's pizza night. So that relates back to what we were saying before about that kind of inflexible thinking. The child may struggle to find the right information in a word problem and to come up with an equation. They stick with a plan even when it's clear that that plan isn't working. And again, that relates back to that inflexible thinking pattern. So what might executive function issues look like in the middle school child? The child may want to invite kids over but never gets around to scheduling or organising it. They hesitate to make after-school plans and instead they just follow what all the other kids want to do or are doing. The child may still be arranging materials in science lab while all the other kids are halfway through the experiment. They may have a hard time starting a big assignment and may waste time focusing on minor or less important details first. They may frequently get upset about small things, like when you run out of their favourite snack at home. So they may get more upset than children of that same age may be. More reactive as well. Often they think the teacher's being unfair when the teacher asks them to do unfinished work later at home, even though the other students have finished their work in class. So that's what it might look like, a small snapshot of how executive functions may impact the child in middle school. And lastly, what might these executive function issues look like in high school? So the adolescent may have trouble finishing short answer tests in the time allotted. They might have a lot of trouble finishing all of their work in the time given to them. They may also lose track of time and they're often still in the middle of something. So they kind of lose track of time and they haven't been kind of managing their time as they go along in the task. They may not have filled any of the notes or forms that have been sitting on their desk or in their school bag for weeks. Important notes and forms at that. They may try to convince you to let them stay out later in the evening with their friends, but they can't often give good reasons as to why. So they might have a more difficult time explaining themselves, explaining the reasons for what they want, expressing themselves in verbal communication in general. I know often teenagers overall do, but teenagers with ADHD especially. They may not know that the teenager with ADHD, they may not kind of tune in and realise that they've overstayed their welcome at a friend's house. So they're not picking up sometimes on those social cues. They're not tuning in, whether it's an attention thing or just a social awareness thing. They're often not tuning into the reactions of other people in relation to their behaviour. They may also have trouble working in groups and complain that other students aren't working with them. The teenager with ADHD may find it harder to incorporate feedback into future schoolwork or other activity. And that's that kind of idea of taking information you learned in one arena and being able to apply it to a different arena. And as we know, teenagers can be impulsive and tend to take risks, but teenagers with ADHD more so. So that's just, again, a little snapshot of what ADHD may look like, executive function issues, and by extension ADHD may look like in children of different ages. As I mentioned in previous slides, the intensity of ADHD symptoms and how much impact they have on the child's day-to-day functioning can be influenced by environmental factors such as school, the amount of schoolwork the child has, factors in the home, parenting, and other social relationships. But the actual causes of ADHD are now known to be largely genetic, that is, biological. And we know this through adoption and twin studies of ADHD. And if you have a look at the graph quickly over to the side, the right-hand side of the slide, you can see that there are different disorders here, and it gives an indication of their relative heritability. So you can see breast cancer there has a genetic contribution of around about 20%. With asthma, it looks around about 40%. And then with ADHD, so something like height, for instance, that we know is highly heritable, might be up around about 90%. Whereas ADHD is around about 80%. And indeed, through the research, the estimates of heritability, the genetic influence of ADHD, are thought to be somewhere around 79 to 90%. So that's really highly heritable. And as we know, that means that if a child has ADHD, there's a high likelihood that a parent, a grandparent, an uncle, or someone else in the family also has ADHD and or learning disorders such as dyslexia, because often those two travel together. But we'll come to that a bit later on in this presentation. ADHD has polygenic inheritance, and that just means that there's no just one gene for ADHD, which is why it's hard to really identify the exact nature of the cause of ADHD. We know it's genetic, but we're not exactly sure exactly what genes yet are implicated. We have some idea. But what we do know is it's likely to be many, many, many genes that actually influence the overall clinical picture of ADHD. And these genes also there are other genes that regulate the expression of those genes. So it's a very complex interplay of genetic and environmental factors that results in the overall clinical picture of ADHD. What is proposed at the moment through the research is that some of the genes that are implicated in ADHD relate to neurotransmitters in the brain, particularly the neurotransmitters dopamine and noradrenaline, or if you live in the United States, it's called norepinephrine, but also serotonin. So it is thought that the genes that regulate for these neurotransmitters are likely to be at least one of the underlying causes of ADHD. So as I mentioned before, the parts of the brain that are implicated in ADHD are largely the prefrontal cortex, which you can see shaded purple in the image in the middle, and also the subcortical regions, which are the kind of the central areas of the brain which underlie the cortical regions. So they're kind of in the middle of the brain, and those include the limbic system and the basal ganglia. But we'll come to that a little bit later. But as you can see in the image to the right, this prefrontal cortex area has areas that are involved with the regulation of attention, behaviour and judgment, and emotional responses. And as we mentioned before, those are the areas of the brain that are involved in regulating executive functions. And again, this is just to summarise and also review the functions of the prefrontal cortex, those executive functions. So the prefrontal cortex, again, as we see in this diagram, is there in orange. It's the part of the brain that helps us plan and make decisions, start and finish tasks, allows us to stay on task once we're started, allows us to block out and minimise distractions when we're working on a task, to use working memory, and to regulate our emotions. And again, those are our executive functions. So there's a group called the ENIGMA group, which is capital ENIGMA, which stands for Enhancing Neuroimaging Genetics Through Meta-Analysis. And this is basically a group of researchers around the world that pool their genetic and neuroimaging data to be able to give a greater depth and accuracy of information about the causes of different brain disorders. And there is a working group, Enigma working group on ADHD. If you want to know a bit more about the work, the Enigma group, the website's down the bottom of this slide. Excuse me. So the Enigma group, the ADHD Enigma working group, published a study in The Lancet this year. And what the study showed was that the brains of children with ADHD compared to the brains of children without ADHD, neurotypical children of the same age, the differences in parts of the brain were, as we did mention before in some of the slides, were reduced in volume compared to those of neurotypical children of the same age. And those areas were specifically as we have known previously, the cortex, and especially the prefrontal cortex, as we've mentioned before, but also, as you can see here on the slide, these internal subcortical regions of the brain, such as the amygdala, which is involved in emotional regulation and recognizing emotional stimuli. The caudate nucleus, which is involved in goal-directed action. The nucleus accumbens, which is involved in processing rewards and in motivation. And the hippocampus, which is involved in memory formation. So you can see just from those functions as well how they might be, these subcortical regions might be implicated in ADHD. And in children with ADHD, these subcortical regions were shown to be much, they were reduced in volume as well compared to children of the same age. What the study did show was that as the children grew, as they approached adolescence, the differences in volumes between the two groups actually got smaller. So the children with ADHD, the volumes of these areas were catching up or becoming closer in volume to their peers as they grew towards adulthood. But as you can see in this picture as well, it's not just these distinct areas of the brain. The subcortical regions in the prefrontal cortex communicate with each other to regulate the executive functions and other capacities such as motivation, emotional regulation. So these arrows in here, they show the different neural pathways in the brain that connect the prefrontal cortex with these subcortical regions. And as we'll see in the next slide, the neurotransmitters that are involved in this regulation are the neurotransmitters that we mentioned before that are thought to be implicated in ADHD. So we have the noradrenaline and the dopamine and the serotonin. So these neural pathways, the connections between the subcortical regions and the prefrontal cortex, these pathways require high levels of dopamine and noradrenaline to stimulation. And in the slide below to the left, it says norepinephrine, and as I mentioned before, that's just the American term for noradrenaline. So you can see that dopamine in the slide to the right, to the slide to the left, the dopamine works between the prefrontal cortex and the internal regions of the brain. It's involved in improving attention and enhancing the signal. So it's to do with the amount of dopamine in those pathways directly relates to the strength of the signal, the strength of the messages that are moving between these two areas involved in regulation. And norepinephrine, the noradrenaline, is involved in dampening the noise. So it's involved in inhibition as well as other functions. So those are the two main neurotransmitters that are involved in this kind of messages between the subcortical regions of the brain and the prefrontal cortex, involved in the regulation of executive functions, motivation, and emotional regulation. Brain imaging studies show a reduction in the level of these neurotransmitters that we just mentioned, dopamine and noradrenaline, in individuals with ADHD. This little picture to the right is a diagram of how a nerve impulse travels from one nerve to the other. So the blue bit at the top is the end of one nerve, and the blue bit at the bottom is another nerve. And it's the neurotransmitter, in this case it's dopamine, are the little red balls, and that's how the nerve impulse travels from one nerve to the other. So what happens is the electrical impulse comes down one nerve, say the nerve at the top, and that causes this nerve to release its little bags of dopamine. You can see in the little circles there. So the dopamine, the neurotransmitter, floods into the synaptic cleft, which is the space between the nerves, and binds onto receptors, dopamine receptors in the nerve below, and that's how the nerve impulse travels from one nerve to another. Now, the body likes to be conservative, so the nerve, instead of making new dopamine more all the time, what happens is the little yellow bits in the top neuron are pumps that will suck up the dopamine back up into the cell to be reused for another nerve impulse. And it's thought in individuals with ADHD that they have more of these little yellow reuptake pumps in the nerve endings. So what's happening is they're actually taking up a lot more dopamine than individuals without ADHD would. So that there's less dopamine available in that in that synaptic cleft, in that space between the nerve endings. And so the message, the impulse that's sent from one nerve to another is not as strong. And interestingly, as you can see, amphetamine amphetamine pharmaceuticals such as Ritalin, they bind in that reuptake pump. So they stop the dopamine from being taken up back into the nerve cell. So there's more dopamine there in that space between the nerves to allow the signals to be quite strong. And that's how it's thought to work. So reduced levels of dopamine and noradrenaline are both implicated in the weakened messages, so the regulation of attention and behaviour in ADHD. I know it's quite complicated, and I just think that it's good to have a visual, often a video demonstration to re-emphasize what I've just said. So if you'd like to have a look at the video below, again, just type in that title and it should come up easily on YouTube. It's a really great little animation that demonstrates not just the transmission of nerves and neurotransmitters in ADHD, but also the different levels of the brain, areas of the brain implicated in ADHD. So I do encourage you to have a look at that, because I think it's a great and short little video to illustrate what I've been saying in the last few slides. Lastly, I'd just like to talk a little bit about some of the other conditions, mental conditions and neurological conditions that often co-occur or coexist with ADHD. You may have heard the term comorbid or comorbidity. That just means that there's a separate disorder that exists at the same time as someone also has another disorder, in this instance ADHD. The thing with ADHD is that comorbidity is the rule rather than the exception. So if someone is diagnosed with ADHD, the likelihood that they will also have another neurological or mental health condition is really quite high. The other thing to remember is that once the ADHD symptoms are treated, it doesn't mean that the other disorder or the other condition will automatically go away, because they're two separate conditions. They just happen to coexist. They may in fact have some shared genetic origin, but they are the two separate conditions. And as I mentioned, and I'll emphasize again, comorbidity or coexisting disorders are the rule rather than the exception in individuals with ADHD. Somewhere between 50 to 90% of children with ADHD will have at least one other coexisting condition. And around about half of these children will have two or more coexisting conditions. One study has found that 80% of adults with ADHD meet the criteria for a comorbid condition. So as I mentioned before, the rates of comorbidity in ADHD are really high. And over here to this diagram on the right, you can see a few of the different issues and disorders that often co-occur with ADHD. You might notice that these conditions tend to revolve around the domain of neurodevelopmental disorders or neurological issues or processing issues. And quite often it is the neurological or neurodevelopmental disorders that have the highest rates of comorbidity with ADHD. Professor Desiree Silva, who's a Perth paediatrician, has done quite a bit of research in the last few years on comorbidity in West Australian children with ADHD, and one of her studies found that 92% of the children in the study had at least one co-occurring mental health condition. So again, just to emphasize that point, that comorbidities are the rule rather than the exception in ADHD. I'm not going to go into the details and the specifics of each disorder in great detail. I just did want to mention and outline the main conditions that really commonly co-occur with ADHD. So this slide we've got here focuses on learning and motor coordination difficulties. So in the category of learning disorders, we have dyslexia, which is problems with interpreting words, dysgraphia, problems with writing, dyscalculia, with numbers, working through numerical problems, and dyspraxia, which is movement coordination disorders, as well as just general reading and writing difficulties. You can see the specific breakdown of estimated prevalences of dyscalculia and dyslexia to the bottom of the slide down here on the right, but just to mention that the rate of co-occurrence of these learning and coordination disorders with ADHD is really high. Maybe half of all children with ADHD will have one of these different disorders. Other neurodevelopmental disorders that commonly co-occur with ADHD include autism spectrum disorder, ASD, which used to be in the DSM that if you had a diagnosis of ADHD, you couldn't then additionally be diagnosed with autism. And if you had a diagnosis of autism, you couldn't then additionally be diagnosed with ADHD. But in the last revised edition, the 5th edition of the DSM, that kind of constraint was lifted, and you certainly can have a coexisting diagnosis of ADHD and autism now. And the rates between autism and ADHD are very high. I mean, I think something around 60 to 70% of children with ADHD also have a diagnosis of autism. This just, I suppose, speaks to the fact that there probably is some underlying genetic or biological mechanism that's common to both these disorders. The other neurodevelopmental disorders that are common in ADHD is developmental coordination disorder. Children with ADHD can quite often have problems with their accuracy and in coordination in sports, running, moving, the big movements that might occur on a playing field, for instance, or throwing a ball. Children with ADHD, as do children with autism, quite often also have issues with processing sensory information, such as noise, light, sound, tactile information. Children with ADHD can often be very sensitive to the feel or texture of food, or the feel or texture of clothing. And again, just down the bottom, another neurodevelopmental disorder is Tourette's syndrome or tic disorder. And it's estimated that the children with ADHD don't have a higher, they're not more likely to have Tourette's or tic disorder than children in the general population. However, if you have Tourette's or tic disorder, you are highly likely to also have ADHD. So if you have Tourette's or tic disorder, the likelihood that you have ADHD as well is around about 60 to 70%. So externalizing disorders speak to the behavioural issues that are commonly associated with ADHD and the sort of behaviours that get kids into a lot of conflict and trouble in both the classroom and at home. As you may be aware, oppositional defiant disorder, or ODD, commonly occurs with hyperactive impulsive ADHD. So the rates are about half of children with ADHD, especially the hyperactive impulsive ADHD, will also have oppositional and defiant behaviours, and they include arguing with adults, not carrying through with requests or actively defying requests, a low frustration threshold for low tolerance for frustration, so they're easily reactive, they quite emotionally expressive, they all have tantrums and get into fights quite easily. So I know that those symptoms will be quite recognisable for a lot of you parents with children with hyperactive impulsive ADHD. The other externalising disorder, which is less common, is conduct disorder. And conduct disorder is oppositional defiant disorder taken to a higher magnitude and really includes elements of antisocial behaviours such as setting fires or harming animals. It's a much more kind of extreme version of oppositional and defiance. Again, conduct disorder the rates of conduct disorder is not as high as the rates of oppositional defiant disorder in ADHD, but conduct disorder is the more serious disorder. Children with ADHD are also more prone to internalizing disorders, and especially, I think, anxiety, but also depression and obsessive compulsive disorder. So these, I guess, they have a prevalence rate of somewhere around 1/3 of children with ADHD will likely have some form of internalizing disorder. It does seem to be that it's the children with the primarily inattentive ADHD symptoms that seem more prone to the anxiety or depression, the internalizing disorders, whereas the children with hyperactive, impulsive or combined type ADHD seem more prone to also having the externalizing or the behavioral disorders such as oppositional defiant disorder. So just to finish, other difficulties that also occur quite frequently with ADHD include enuresis, which is bedwetting. So somewhere again around 1/3 of children with ADHD also have enuresis, problems with enuresis. Sleep problems. So maybe it's 3 times more prevalent in children with ADHD. This could be due to the hyperactivity, just the way their brain is. They find it more difficult to relax in the evening. It also may be sometimes due to the stimulant use, the medication use that's keeping them awake later on in the evening. As we mentioned before, children with ADHD have issues with impulsivity. They're much more likely to act before they think of the consequences. They're much less likely to be cautious when they are playing or when they're out and about. So that can lead to higher rates of accidental injury in children with ADHD. And as we mentioned before, children with ADHD very frequently have social issues and peer difficulties in relating to observing how their behaviour is impacting on their peers and also kind of regulating their behaviour when they're with their peers. So that can lead to social difficulties that can really be distressing for both parents and children with ADHD. So these are just some of the common conditions that can occur with ADHD. So we've come to the end of the first webinar. What is ADHD? And I know in this webinar we have focused quite heavily on some of the issues and the challenges that children with ADHD do face in relation to their symptoms and how the symptoms of ADHD can impact on their daily life. But I did want to emphasize that the main aim of these webinars is to give parents the information and some strategies and skills that they can use to support the child and in the home environment and to help the child to minimize the impact of some of these ADHD symptoms on their lives. So what did we look at today? We looked at what ADHD is, the nature of ADHD and how it's defined. We talked about how ADHD is a brain-based biological condition. It's not the result of bad parenting, and it's not the result of willful disobedience on behalf of the child. So they're not being intentionally naughty. It is the result, as we talked about, of dysregulation in the brain in relation to the regulation of executive functions in the child with ADHD. We discussed that ADHD is often a lifelong condition, but that there are treatments, pharmacological and behavioural and psychological, and strategies as well that parents and individuals can put into place in the home, in their daily lives, that can help them manage the symptoms and the impact of those symptoms on their life. We looked at that there are other conditions that often can co-occur with ADHD, and although treatment for the symptoms of ADHD may not help resolve these other conditions, often if the other conditions are treated by a trained professional such as a psychologist, that can minimise the impact of the overall burden of symptoms on the child's or individual's life in general. So often it helps to have treatment for the ADHD, for the anxiety or the depression, or some parent training in relation to how to manage the oppositional defiant disorders in combination with treatment for the ADHD symptoms. And lastly, we just wanted to emphasize again that with help and understanding, your child will learn to manage the ADHD symptoms, and that you as parents can do a lot to help them and support them in managing their symptoms, and to help them make the most of their wonderful strengths and talents, the things that make them shine and make your child who they are. So thank you for your attention, and the next webinar session we'll be looking at parenting your child with ADHD. We'll be looking at, in general, modern ideas of positive and responsive parenting and mindful parenting. What constitutes mindful and responsive parenting? But we'll also be looking at it through an ADHD lens, and we'll be looking at what are some of the specific issues that parents who are parenting a child with ADHD face. So thank you for joining me, and we hope to see you for session 2.